Good afternoon and welcome back to the Vitrolife Group Academy Studio, the afternoon sessions. Today it is my pleasure to introduce you Dr. Leyre Cordero, coming from Ovobank Group in Spain. And
For the
she's going to talk
invitation.
about the carrier screening. Dr. Cordero?
Thank you for the invitation,
Very welcome.
Nasser. On my behalf and also on behalf of the Ovobank Group, thank you very much for having us today. And to begin with, I'm going to talk about the carrier screening test and how to optimize your IVF outcomes. Okay, to begin with, as assisted reproduction professionals, one of our main goals is to achieve a healthy child, to help our patients to achieve a healthy child. This is to prevent the offspring from disease. We can do this at the preconceptional, preimplantational, or prenatal level. And to do so, several strategies have been developed through the years to achieve as much genetic information as possible. We have, for example, at a preconceptional level, the carrier screening tests, at a preimplantational level, the PGT, so preimplantation genetic testing, and as a prenatal level, the amniocentesis or chorionic villus sampling. Ideally, one of the main approaches could be the preconceptional level. This is before fertilization step takes place. Why is this prevention I'm talking about every day and all the time so important? Okay, around 84% of the individuals are carriers of at least 2 genetic mutations. Moreover, around 2 to 5% of the couples are at risk of having a child with an autosomic recessive or an X-linked disease. And according to the World Health Organization, 10 out of 1,000 newborns are affected by any of these genetic conditions. So, taking all of this into account, genetic disorders represent a significant impact in our society. And there is indeed the need to identify the risk and also prevent its consequences. The most common are autosomic recessive or X-linked diseases, genetic diseases, according to the WHO, are alpha and beta thalassemia, sickle cell anemia, Tay-Sachs disease, Fragile X syndrome, cystic fibrosis, and hemophilia. At Ovo Clinic and Ovobank, we are very, very conscious about this fact, and this is why we perform this carrier screening to both our patients and to our donors. What does carrier screening do? Okay, first of all, it identifies the individual with a certain mutation or several mutations that can give rise to an affected child. And moreover, it compares the information from both individuals, in the case, for example, of a couple, of the male and the female, and in case of heterologous IVF treatments, as we do normally in our clinic, it compares the patient with the gamete donor, the egg donor or the semen sample donor, matching them and determining the reproductive risk of genetic disorder. Okay. This reproductive risk gives us information in order to help both the clinicians and the patients to consider the most complete range of reproductive options and help us take better clinical decisions. So, the recommendations for this genetic carrier screening would be to any couple who wants to conceive knowing the risk of having an affected child, before an assisted reproduction treatment using their own gametes inside a couple. Also, we could recommend this genetic carrier screening before a gamete donation treatment to test the donor and the patient, and also to couples with a medical history of a specific disease. Okay, if you look up in the internet for carrier screening, you may see that there is a very broad choice of tests. So which one should we choose? I choose this article from 2021 it is a review that analyzed 16 companies that were offering 42 carrier screening panels. And the conclusion they arrived to is that there is a very large diversity depending on the panel. Why? Because some panels analyze from 3 up to 1,577 genes. So this is quite a variability between the panels. Moreover, an overall of 2,673 diseases were screened, but none of them were present in all panels. This means that some panels miss some diseases and another ones miss other ones. So there was no test that analyzed all the diseases. So the conclusion of this paper is that there is still the need to develop a standardized panel for all in order to facilitate later on the matching between the individuals. Okay, at Ovo Clinic and Ovobank, as an IVF clinic and also a gamete bank, we perform the 3 CGT options offered by eGenomics. we perform the CGT Plus on our patients, and we perform the CGT bank and CGT exome in our donors to later on facilitate the matching step, but we will arrive to that, don't worry. First of all, CGT test by eGenomics introduce or perform the whole exome sequences. This is, they identify the variations in the exome. Why it is so important? Because it is the protein coding part of the genome, and it constitutes around 1 to 2% of it. And it is so interesting for us as embryologists and also IVF professional because the exome encodes most of the known disease-related variants. So by sequencing the exome, we have an optimization in the screening in terms of time, cost, and efficiency, because we don't have to sequence the whole genome. We just focus on the exome. Okay, this is quite a summary of the available panels by eGenomics. The CGT bank is a panel exclusively performed on donors, and it analyzes 7 of the most common gene variations, that could be plus 65 X-linked genetic disorders. On the other hand, well, apart from CGT bank, to our donors, we perform the CGT exome, which is the sequencing of the whole exome. And to our patients, we perform the CGT Plus, which includes around 170 genes linked to autosomic recessive disorders, plus including the 65 X-linked genes. Okay, here I brought an example, a real example actually, because it's Clinic Madrid, about a CGT bank that we received from eGenomics, our reports. And what we do is, if the CGT bank, the donor tests negative, it means that she is not a carrier for any of the 7 analyzed genes, plus the 65 X-linked related disorders. Therefore, she is accepted in our bank. If the donor would test positive, for example, for the CGT bank, we could exclude her from our bank, because this means she's a carrier of one of the most common 7 autosomic recessive diseases or X-linked diseases. Okay, as we have talked before, we perform CGT bank and CGT exome in our donors to achieve as much information as possible, as much genetic information as possible, to facilitate this matching step. Why? Because to our patients, we perform the CGT Plus, so we have already the whole data, genetic data about the donor, where we are doing the matching step. So the matching is automatically done. We don't have to retest the donor. Why? Because retesting the donor would mean an increase in cost of time, money, and a new blood extraction. So in this way, we already have the whole data. In fact, CGT exome, the data can be upgraded so that we can perform the matching step in a very easy way. And moreover, we don't have to store the frozen blood of the donor. Okay, what happens if the donor and the patient, for example, tests positive for an autosomic recessive disease? So they are carriers of the same autosomic recessive disease. You can either change the donor or go on with the same donor and perform the PGTM on the embryo, the monogenic disease. Particularly, we wouldn't advise to go on and perform the PGTM. What we would advise is to change the gamete donor. Why? Because going on and perform the PGTM on the embryo would increase the risk of a disease, and moreover, it will increase the cost. You have to retest again. Last but not least, I wanted to highlight some aspects to consider about the carrier screening tests. eGenomics CGT achieves a 98% of sensitivity. This is, they have very few false negative results. No test achieves 100% of sensitivity, so we can be sure and we can go on by achieving a 98% of sensitivity. It's quite a good result. Moreover, we only get to know the information about the analyzed genes. We should take into account that if we are testing several genes, we can't get information about the ones that we are not testing. So we have to take this aspect, we have to consider this aspect when performing carrier screening tests. Moreover, as the sample comes from a blood extraction, we can detect the germinal mosaics. And even if the test tested negative for the carrier screening and also we have a favorable matching, a de novo mutation may appear in the offspring and we can't be sure to detect it. And last but not least, I asked this question of a standardized panel for all because you have seen there is a broad choice of tests depending on where do you look at or in which web do you look at. But eGenomics CGT panel allows the universal matching with other reference laboratories panels. And as conclusions of the presentation, we may say that genetic disorders are relevant in our society. We have seen the statistics, the 84% carriers, etc. And therefore, we need to identify the risk and prevent its consequences. Carrier screening should be advised to any person wanting to conceive, and especially in IVF treatments and in heterologous IVF treatments, as we perform in our clinic and Ovobank, it is very important for achieving IVF optimized outcomes. Moreover, I wanted to highlight the point of the need of a standardized universal panels, because nowadays we have a lot of different panels and not all of them test for the same diseases. So this would facilitate the matching and determine the reproductive risk to take the best clinical decisions. And the whole exome sequencing technology from eGenomics optimizes the process in terms of times, money, and easy or efficiency in the interpretation of the results. To finish a little bit with this short presentation, I wanted to highlight that genetic conditions cannot be cured, but can be prevented. And this is what we try every day as IVF professionals. Thank you very much.
Thank you. Thank you very much,
Thank you.
Leyre. Fantastic presentation.
Thank you very much.
Is there any question on the audience?
Hi, Leyre.
Hi,
Thank you
good
so much
afternoon.
for the presentation.
Thank you.
I wonder if you have followed up the donors that are positive for example, for is-linked condition.
For, excuse me?
Is-linked. Any is-linked condition that maybe you cannot get the oocytes from that donor because there is direct risk.
Okay.
Do you know if they follow a treatment or you have chance to see that? I mean, if donors discarded from the programs because of an is-linked positive result, they go then, I don't know if you have your data, then come to your clinic to follow PGTM or something like that?
Do you mean if we accept them and later on perform the PGTM to the embryo?
Yeah. Something like a follow-up of that result. You cannot get the oocytes to be used for other treatments, but
actually, I guess we directly don't accept them because we are very rigorous about the CGT bank. So we want to make sure that at least in those 7 most common autosomic recessive diseases and the X-linked, they don't test positive for any, they aren't carriers of any condition.
okay.
I could say so.
Thank you.
Thank you very much.
Anyone else? So, how about this kind of tests are mandatory at the clinic, or what do you think about it?
Okay, for the patients, they aren't mandatory. They are offered to our patients, the CGT Plus, but we highly and strongly recommend for them to perform the CGT. Otherwise, you are kind of blind in the process of the matching step, and it's no use. It increases the cost, time, money, and moreover, the psychological aspect, obviously. So we prefer to offer them the possibility to perform the CGT Plus, and then perform the matching step, making sure the offspring will be healthy. Thank you very much.
Super clear. Thank you very much.
Thank you so much.
Thank you all for your attendance, and see you all in 15 minutes to talk about non-invasive POC. See you later.
Thank you.
Thank you.